The SUDEP and Seizure Safety Checklist is a tool for any health professional who sees people with epilepsy to support them in having conversations with their patients about the risks linked to SUDEP and other forms of epilepsy deaths. Up to 80% of epilepsy-related deaths are thought to be preventable, with patients and their families knowing about the risks linked to the condition being an important step to improve safety and avoid deaths. If you haven't already watched it, please see our What is the Checklist video for more information about the tool before watching this one. So, how should I use the checklist? Each health professional may choose to use the checklist slightly differently to suit what they already do to discuss risks with their patients. It can be helpful if epilepsy teams use the same approach so there is consistency in how risk communication is happening and being documented in patient records. We would encourage the checklist is used in its entirety and isn't split up or adapted into other existing documents. This could lead to key information being missed and runs the risk of old versions of the checklist remaining in use, which could miss vital new risk information or resources. The checklist should be used at regular intervals to keep an eye on changing risks. As research has shown, risks can become fatal in as little as 3 to 6 months. How regularly the checklist should be completed will depend on each individual patient, the number of risks they face, and how confident they are to take positive actions to reduce them. However, it should happen at least once a year for all patients. Given risks can fluctuate, avoid labelling patients as high or low risk, as this can give a false impression. Instead, the focus should be on what steps can be taken at each appointment to reduce any flagged risks. How to navigate the checklist. On the left-hand side are the key risk factors flagged by research as being important for health professionals, people with epilepsy and their family to know. The checklist always begins by looking at seizure-related factors, as we know that getting control of seizures is a key step to reducing risk of premature death. Other factors are also important to consider, such as lifestyle, well-being and other health factors. These factors might not apply to every patient at each risk discussion, but are important to know about so people with epilepsy can make informed choices about their lives and how it might impact on their epilepsy. There are also background risks that are helpful to know about, but are unlikely to be modifiable. We know that not every health professional will be comfortable and confident in discussing epilepsy mortality risks with their patients, especially if they are new in role or don't see many people with epilepsy. There are pop-up boxes for each risk factor to provide simple questions to help get conversations going in a way that will help you determine if there are risks present for each patient. Also, in each pop-up box, you will find a short summary of the research evidence for the risk factors. This can be helpful for your own knowledge, but also to help show why it is important each risk is discussed and why each risk is taken seriously. This summary is taken from the key research papers underpinning the checklist tool. Thousands of papers have been reviewed as part of the checklist project, and each version of the checklist comes with a core reference list of the latest key research papers, should you wish to learn more. As part of the discussion, health professionals can note yes or no for each risk factor to indicate if that risk is present for their patient. It is important to note that this is not a scoring system and does not provide a level of risk, as research is not robust enough to do this accurately yet. What it provides is a total number of risks, and the aim is to reduce this number as much as possible. There are multiple columns of yes/no buttons, so you are able to do multiple risk discussions on one form and track how the patient's risks are changing over time. This is the most important section on the checklist. There is no point discussing and identifying risks if you don't also discuss what steps can be taken to reduce them. Some of these actions may be things you or other health professionals will support the person with epilepsy to do, such as medication changes or referral to other services. But some actions will be clear things the person with epilepsy can and should take responsibility for doing, such as setting a reminder to take their medication or using the EPS1 app to keep an eye on their risks in between appointments. In the Actions column, for each strand there are resources and signposting information to support your discussion about what actions should be taken. Whatever risks are present, The actions you and your patient agree on can be noted in the summary box at the bottom of the checklist. Remember, once completed, the checklist can be added to their patient records, and you can print or email them a copy to provide a reminder of what was discussed. This is particularly important given epilepsy often comes with memory issues, and we know that risk information can take time to be fully remembered and understood. Those are the key sections of the checklist, which hopefully give you a starting point for using the tool as part of your risk discussions with patients moving forward. Should you have any questions about using the tool or would like to share with us how you use the tool in your role or team, please get in touch and email in at checklist@sudep.org.